For that, we will have a talk by Pol Cleries Rovira. He's a doctor pharmacist here at Bellvitge University Hospital. He's also the ECD Care Center pharmacist, which this is the care center. So he's going to be talking to us about ECD treatment side effects. So thank you.
Okay. Hello, everybody. Thank you for having me at this gathering. And for those of you who've come from far away, the warmest welcome into our hometown. My name is Pol Cleries. I'm a pharmacist here in this hospital, and today we're going to talk about ECD treatment side effects. So this is what we're going to see today. We're going to do a quick review of the treatments. We're going to talk about the side effects of some of them and how to monitor them and how to manage them as well. And finally, we'll take a sneak peek into the future strategies. So first things first, what is a side effect? So basically, it's an unpleasant effect we get from taking a drug, medical treatment, or vaccine that comes in addition to the main intended effect. So it's something that we don't want, but it could happen when taking a treatment. There are certain types of them. For example, the dose-related ones where exposure is key. I'm going to talk about this in a minute. The allergic reactions, which are person-dependent, and the idiosyncratic, which are not really fully understood, and they are hard to predict, actually. A common misconception my patients usually have is that some treatments are completely safe to take. The truth is, all kinds of treatments, even over-the-counter treatments, have side effects. It's just that they don't always present themselves. So now let me explain a bit about exposure. Please take a look at the graph on the left. It shows the amount of medication there is in our body through time. This is exposure. This is how much we are exposed to a certain medication. As you can see, when we take one dose of medication, exposure goes up, and after a while, it naturally goes down. But why is this important? Because in general terms, if exposure is too high, we may be more at risk of suffering a side effect. And if it's too low, we may be more at risk of not getting enough benefit from the treatment itself. What we aim to do is to find the right exposure for each patient, one that can assure a balance between treatment efficacy and side effect burden. And how do we do that? There are several ways. A couple of them are increasing or decreasing the dose we're taking of the medication, or perhaps giving a treatment holidays, which consists in not taking the medication for a short period of time. We've seen this before today. These are the biological pathways that are related to Erdheim-Chester manifestations. With the years, we've learned that by blocking some of these pathways with medication, can lessen the burden of symptoms for this disease. Unfortunately, today we are not going to have the time to review all the side effects for all these drugs. But we're going to focus today on the targeted therapies, which are the ones that are more used today, especially the BRAF inhibitors and the MEK inhibitors. So starting with the BRAF inhibitors, we've got two drugs that are the most used in this group. That's vemurafenib and dabrafenib. As you can see, there's a range for the dosage, because we usually start with a smaller dose and then we go up until we find the best dosage for each patient. These medications are taken one in the morning and one in the evening, one dose, always by mouth. Vemurafenib can be taken with food or without food, but always in the same way. And dabrafenib is to be taken on an empty stomach. Some side effects for vemurafenib. We need to be careful with the sun, because it can make you sensitive to the sunlight. It can also give you an upset gastrointestinal tract. When it comes to the heart, it can produce changes in electrical activity, which sounds really scary, but with the proper monitoring and follow-up, it shouldn't pose too much of a threat. You can also feel more tired or have body aches and have some inflammation in the eyes. As for the dabrafenib, we need to watch out for fever and fatigue. There's something really specific, which is the hand-foot syndrome, in which we can have redness and swelling in these two body parts. Also, the gastrointestinal tract can act up a bit. Be careful with those of you who might have diabetes, because it can also increase your blood sugars, and you can also experience visual disturbances. So how do we monitor these side effects for the BRAF inhibitors? So we need to complete blood work periodically as your doctor deems appropriate. A skin exam before starting any treatment, and then ideally monthly and up to 6 months after stopping the treatment, if stopped at all. If you experience any changes in your sight, please call in for an eye exam just to make sure everything is all right. Specifically for vemurafenib, we need an ECG which monitors the heart function before the treatment for reference, and then every time we change the dose, we should be taking one a month after. Moving up to the next group of medications, the MEK inhibitors. Again, we've got two medications which are the most used, cabimetinib and trametinib. You have as well a dose range, because we also start with a lower dose and then move up. Please be careful, because trametinib is to be stored in the fridge until the first use. These two medications are to be taken once a day, but please mind that cabimetinib is taken in a cyclic manner, which means that in a period of 4 weeks, you should take a pill every day for the first 3 weeks, and then the 4th week, you don't take any medication. After that, we are going to start over. Always taken by mouth. Cabimetinib can be taken with or without food, and trametinib needs to be taken on an empty stomach. Some side effects for these two medications. There could be a bit of muscle toxicity, so watch out for any muscle pains or muscle crampings, or if your urine starts getting a dark color suddenly. Protect yourself from the sun, this is really important. The digestive tract can also be a bit irritable. As for the heart, it could happen that you have a decreased cardiac output, but this, again, with the appropriate monitoring, it shouldn't be too troublesome. And also like some eye toxicity that could lead to visual disturbances. How do we monitor these side effects for the MEK inhibitors? Again, a complete blood work, ideally every month. A left ventricle function before the treatment for reference, and then a month after starting the new treatment, and every 3 months after that. If you experience any changes in your sight, please call in for an urgent eye examination just in case. Finally, a skin exam should be done before the treatment, and then periodically and up to 6 months after stopping the treatment, if stopped at all. So how do we manage as healthcare providers these side effects? Well, the answer is that it depends. It depends on how severe these side effects are, because if it's not causing you a lot of trouble, or if it's something that just comes and goes, we might just choose to monitor the situation just in case it gets worse or better. If it's starting to be a bit more troublesome, and if there's something that we can do, we might choose to treat these side effects if possible. If your quality of life starts to get affected and it's something more persistent, we might opt to lower the dose a little bit so you'll be more comfortable without compromising efficacy. And finally, if the side effects are something more severe, that your quality of life is quite impaired, we might ask you to just withhold the treatment for a period of time or indefinitely, depending on the case. So this is Emily. This is she's a Erdheim-Chester patient who's been listening to this session, and she's now wondering like, okay, now I've got all this data, but is there really something I can do about this? Is there something I could just prevent things or just make things better if any side effects should come up? Well, the answer is yes. There are some international guidelines that provide recommendations to patients. So when it comes to skin, for example, it is recommended to avoid very hot water or skin irritants. You should also moisturize your skin at least twice a day with an alcohol and scent-free lotion. Try to avoid perfumes because they have a high content in alcohol, which could be an irritant for the skin. Try to choose loose-fitting clothing, preferably with breathable fibers. And when it comes to sunlight protection, it is recommended to wear at least 15 SPF all year round, but in my opinion, it should be a bit more than that, especially in countries like ours, where the sun can be quite merciless, to be honest. Try to avoid the sunlight exposure between 10 a.m. and 4 p.m. and always choose clothing that covers your legs and arms if possible. When it comes to tiredness, what's actually recommended is that you keep active. 3 to 5 hours a week of physical activity should be enough. Try to mix aerobic exercise and strength and flexibility exercise. With this, I'm not telling you that you should join your closest gym. Home-based exercises should be enough. A bit of brisk walking, and if you have one, a stationary bike with light effort should go well. Of course, you should do that within your own physical capabilities and always consult your medical team before doing any exercise. Going to the gastrointestinal tract, if we're experiencing diarrhea, you need to know that you should seek urgent care if you have a high fever or if you have very painful abdominal pain. Otherwise, oral rehydration works wonders for that, but that only if you haven't been told not to increase your liquid intake. Drinking broths, fruit juices, soft drinks, anything like that should do well. Avoid vegetables or high fiber foods, as well as fatty and spicy food, which could be irritant to your stomach. If instead we're suffering from constipation, also increasing your fluids intake should work well, unless you've specifically been instructed not to do so. Try to eat more fiber foods, increase your dietary intake of greens, and just be active because that could go a long way in constipation. As for nausea and vomiting, try to eat small quantities of food throughout the day, like frequently, and please avoid any foods that particularly make you more nauseous. Keeping a good oral hygiene is key because bacteria buildup could worsen your symptoms. And I know there's like a lot of alternative therapies for that, but just make sure your medical team knows about them before initiating them, just as a precaution. When it comes to your heart, please let your doctor know immediately if you have an irregular heartbeat or if you're feeling lightheadedness or even if you lose consciousness. Also, it's important to notify when you've had gained weight in a matter of just days and like in a week, especially if your legs and feet are swollen or became swollen. When it comes to blood work, it's very important not to miss any of your appointments for your blood works because some of the side effects are only seen through your lab works. So please do not miss these appointments. Lastly, I would like to talk about interactions. What are these? These are incompatibilities between two medications, for example, or a medication and food. That's why some of the treatments are to be taken on an empty stomach, and also between medications and supplements or herbal remedies. But what are these interactions? To make it simple, they may increase or decrease the exposure of the medication we're taking, which in turn could mean suffering more side effects or experiencing a decrease in treatment efficacy. What I recommend is that always you should tell your healthcare providers exactly what you're taking, even if it's over-the-counter treatments. As you can see, I've put two examples of innocent-looking troublemakers, which actually increase the exposure of all the treatments I've mentioned today. Finally, I would like to talk about briefly about the possible future. This is the therapeutic drug monitoring. It's still not well established for Erdheim-Chester disease, unfortunately, but we actually use it for some other diseases and treatments. The goal of this circuit is to actively monitor drug exposure in our patients in order to anticipate the appearance of side effects or even loss of efficacy. For each individual, we assess the right exposure, and that could allow us to make those changes before the patient experiences any discomfort or any side effects. So again, this is not happening for Erdheim-Chester, unfortunately, but there is some evidence with some of the treatments I've talked about today for when it comes to monitoring. So hopefully in the near future, there could be some evidence for Erdheim-Chester as well, just as a heads up to what might come in the near future. Finally, some of the take-home messages. I recommend to be vigilant of any changes, sorry for the typo, in your body after starting any treatment. Report anything out of your usual. You're the ones that know yourselves best, so you know what works for you, what it doesn't work for you. So anything outside your usual, just report it. Talk to your doctor or pharmacist if you're concerned about a particular side effect, and ask for advice or guidance. Do not take any new medications or supplements without letting your healthcare providers know, because it could lead to an interaction, and it could lead to troublesome problems with your treatment. And please do not hesitate to ask any doubts because they may arise at any time during treatment. We're a whole team. We're doctors, we're nurses, we're pharmacists. So of course each of us do their part, but we communicate every day. We can just call each other, we can just write an email to each other. So anything at all, just let any of us know, and we'll sort it out for you and get back to you with an answer or solution to your problem or doubt. All right. So thank you very much for listening to me, and if you have any questions, I'll be happy to answer them.
Thank you. Any questions?